Hi, I'm Sharon, and I'm here, and we're going to present normal bowel function. Here's an overview of the GI system. The gastrointestinal system consists of a muscular tube that runs from the oral cavity to the anus, along with accessory organs of the teeth, tongue, salivary glands, liver, gallbladder, and the pancreas. The main functions of the GI system are ingestion of food in the oral cavity, the breakdown of food, which is crushing, shearing, and chemical breakdown of food before propelling it along the digestive tract, absorption, the movement of vitamins, minerals, and water into the body through the digestive epithelium, and defecation, the elimination of solid waste from the body. This waste matter is called feces and it is ejected through the anus. And now we'll watch a video explaining all that.
Your digestive system consists of all the organs involved in breaking down the food you eat, absorbing nutrients, and eliminating waste products. When you take a bite of food, your digestive system is activated automatically. In the stomach, the food is broken down into smaller pieces and digestive juices are added. The now liquid food is passed on to the small intestine, where the nutrients are absorbed and digested. In the large intestine, also called the colon, water and salts are absorbed, causing the waste products to become firmer and turn into stool. The stool is then pushed through the intestine towards the rectum by a series of muscle contractions known as peristalsis. You have 3 to 4 major peristaltic movements each day. The time it takes for food to pass through your digestive system is called the transit time. The average transit time for females is 2.4 days and 1.9 days for males. When stool fills your rectum, nerve endings register that your bowel wall becomes distended and a signal is sent to your brain telling you that it's time to find a toilet. At the same time, your internal sphincter relaxes by reflex and stool moves down towards the anus. When you are ready, you consciously allow the external sphincter to relax and stool is expelled. In between going to the toilet, both the internal and the external anal sphincter are contracted to keep you continent and to prevent leakage.
Hi, my name is Victoria and I'll be talking about the process of defecation, which includes it starts with the elimination of waste. So it begins with when the feces over here enters the anus, the rectum by peristalsis, and the rectum becomes distended. Stretch receptors stimulate the contraction of the sigmoid colon along with the rectal muscles here. The internal anal sphincter relaxes and sensory impulses get transmitted to the sinus, causing the urge to defecate as shown here. And contraction of the diaphragm and the abdominal muscles allows the relaxation of the external anal sphincter. And then the feces are expelled. The Valsalva maneuver assists with the process of defecation. It increases the abdominal pressure within your abdominal cavity to expel the feces, as shown here by this man. And you start by contracting the abdominal muscles, which is called straining here, and then while closing the airway, holding the breath. And I would advise clients with heart disease glaucoma, increased in cranial pressure, or a new surgical wound to avoid this Valsalva maneuver because of the increased abdominal pressure.
Hi, I'm Emily, and I'm going to be informing you on what stool is and normal bowel movements. So, according to the NIC Dictionary of Cancer Terms, stool is material or solid matter of body waste. It is undigested food. It contains a lot of bacteria, mucus, and cells from the lining of the intestines. It's referred to either as human feces or bowel movements. It can also be used for medical testing purposes. Okay, so what is normal stool? So normal stool is soft, formed, it's semi-solid, and it contains 75% water and 25% solid. So factors determining stool is how long the stool is in the colon. So this affects if a lot of water is absorbed, it becomes harder in the colon, developmental stage. So this would be like infants have tarry black stool, and that's normal for them. Medications, so opioids can make you constipated and harder stool. Vitamins, nutrition, depending on what fiber you eat and how much fiber you eat, food allergy intolerances as well. And what is normal bowel movement patterns? So normal is personalized and it's a wide range. There is no specific answer to what is a normal bowel movement pattern. Typically, they say that someone should at least have a bowel movement. They can have it at least several times a day to several times a week. There should be no urgency, no straining, no blood loss, or use of laxative. Factors determining bowel movement pattern are motility, nutrition, depending on what you eat, hydration, stress. Stress can cause the bowel movement to either pass through quicker through the colon or slower, determining on how your body reacts to stress. The environment, so if you have enough time, or if you have enough privacy and you feel safe. Certain medications and vitamins, high vitamin C, can lead to diarrhea. And then physical activity, so if you're bedbound or physically active, can determine how often you have bowel movements. And then surgery.
Hi, I'm Callie. I'm going to be talking about patient education for bowel movements, starting with the normal things, normal bowel elimination, and common things to keep your bowel elimination processes normal for you. So eating a regular schedule can help keep your bowel eliminations regular. If you are eating randomly from day to day, that can affect the bowel eliminations, won't become as regular for you. And drinking water is a huge factor in keeping a normal bowel process for individuals. So educating patients on the importance of staying hydrated, and 6 to 8 cups a day is the recommended amount of water that should be consumed. But of course that can fluctuate. If you have tons of physical activity, you may need more to stay hydrated, or it can start to affect your bowels. So high fiber foods, this is another big one. 5 servings a day is recommended to keep the normal bowel process, and that can be raw veggies are a good example, fruits, berries, whole grain cereal, popcorn is even a good one, flax seeds, beans, to get the five servings a day. and physical exercise. So, like the picture shows here, physical exercise can keep the feces moving through the system, so it can be eliminated. Otherwise, it can, patients that are have immobility issues, sometimes, positioning them can help, but physical exercise is a big one to keep the bowels going through your body so they can be eliminated. So factors that can lead to diarrhea. And diarrhea is loose stools that abnormal get passed through your body quickly. So too much fluid, so if you're too hydrated. But a big one is coffee can affect people, can kind of have a laxative effect. And too many sugary beverages can affect and lead for diarrhea. So that's a patient education. And stress, so eliminating stress can lead to diarrhea, but it can also cause constipation. So the stress factor related to bowels is something that patient education should be taught. And then there is different supplements and medications that can affect diarrhea. So magnesium and vitamin B, and then medications, laxatives, of course, and then antibiotics. So the antibiotics, patients who are taking those, it can eliminate the normal bacteria in your colon and can lead to diarrhea. So a teaching that can be given to patients is to eat yogurt to try to balance out and not get rid of the normal bacteria in your colon. And then certain foods, so spicy foods can affect diarrhea in people, or high fats, snacks of really high fat content. And there can also be personalized foods that can affect personal people. So factors that lead to constipation. So not enough fluids. If you don't have enough fluids in your system, the feces becomes hard and can get backed up. Lack of physical activity, so patients who have immobility issues, and this can affect constipation. So bed rest or illness. Certain medications can lead to constipation. So opioids are a big one. They have a really high constipation incident rate. And then side effects from medications, stress, which I already talked about, and then calcium supplements can lead to patients being constipated. And then food intolerances or allergies, people that suffer these should be taught the linkage between the food allergy they have and the constipation, and factors that can help so they do not become constipated. So that is the end of our presentation.